As a doctor, I'm still prescribing the same treatments I was as a trainee over 20 years ago, and that's not good enough for our patients. Our programme really seeks to make a major difference in how drugs are developed for chronic lung disease and infection. 1 in 4 of us will develop a lung disease at some time in their life. 1 in 5 to 1 in 6 people will actually die of a lung problem. Chronic lung conditions don't happen overnight. They often develop due to lifetime exposure to certain factors, and our conditions are often very complex and individual to a person, so developing drugs for these conditions is difficult because we don't have the right models, and preclinical drug testing can take many years, and the way we develop drugs at the moment has not been precise enough. What we're doing differently is developing organoids, mini lungs, which really represent the complexity of the lung itself. Our programme is partly based at University of Southampton, so we can rapidly take samples and start to develop our organoids.
Lung organoids, they are tiny. I've got a lot of organoids. Oh, they look beautiful actually. Organoids are cultured in 3D cells that, instead of being on plastic, interact with each other and differentiate as if they were in the tissue. And the lung is 40 different cell types. The cells look very, very healthy. They are fully ciliated. The organoids mimic the human lungs, so you can test it, and we're much more confident that what we got is actually what physiologically happened. Next week they will be mature and I will do infection with influenza.
We can infect them with bacteria. We can expose them to pollution or cigarette smoke in our Biomedical Research Centre here at Southampton. And then we can use these infected models to actually try new drugs. In order to understand how these organoids are responding to these stimuli, a team of engineers are actually developing entirely new platforms.
So this is a light sheet microscope that we've built. We can reconstruct a 3-dimensional image in 13 seconds. This is one of the mini lung organoids.
It takes a village to grow an organoid. We try to identify very quickly which drug they can actually progress to the clinical phase.
Preclinical drug testing could be cheaper, faster, reducing by 2 or 3 years in many programs. The drugs that we develop could benefit people entirely specifically, and we can really make a difference for a greater number of patients.